Hey there, future doctors. Today I'm diving into something pretty fascinating, but also crucial for your medical journey: complex partial seizures. So what are complex partial seizures? Unlike generalized seizures that affect the whole brain, complex partial seizures start in one specific area. They're called complex because they impair consciousness, and partial because they're limited to part of the brain. Now let's talk about symptoms. These seizures can be a bit tricky to identify. Patients might experience unusual sensations or emotions like déjà vu, fear, or even a strange taste in their mouth. You might notice repetitive movements like lip smacking or hand gesturing. And here's a key point. During a complex partial seizure, the patient won't fully respond to you. They might seem like they're in a daze, and once the seizure is over, they often don't remember what happened. Next up, diagnosis. To diagnose a complex partial seizure, a neurologist would typically order an EEG or electroencephalogram to track the brain's electrical activity. MRI scans can also be helpful to pinpoint any structural abnormalities in the brain. When it comes to treatment, anti-epileptic medications are usually the first line of defense. Medications like carbamazepine, levetiracetam, and lamotrigine can be quite effective. Sometimes, if medication doesn't work, doctors might consider surgery to remove the affected brain tissue, and in some cases, devices like vagus nerve stimulators can be implanted to help control the seizures. Now, on to prevention. While you can't always prevent seizures, managing stress, getting enough sleep, and taking medications as prescribed can reduce the frequency of these episodes. It's also crucial to educate patients about avoiding seizure triggers, like alcohol and flashing lights. Lastly, remember that understanding and empathy go a long way. Patients with epilepsy often face stigma and misunderstanding. Being knowledgeable and supportive can make a huge difference in their lives. Alright, that's a wrap on complex partial seizures. Keep this knowledge tucked away for your future practice, and remember, every bit of understanding brings us closer to better patient care. Thanks for tuning in, and keep pushing forward in your medical journey. Catch you in the next video.